Which prenatal test is better, invasive or non-invasive? Imagine being able to learn about your baby's health early in pregnancy without risking harm. That's what prenatal testing is all about. But deciding between invasive and non-invasive tests can be confusing. Let's break down what each involves so you can make an informed choice. Non-invasive prenatal testing uses a simple blood draw from the mother, usually around 9 to 10 weeks into pregnancy. It looks for tiny fragments of fetal DNA floating in the mother's blood. This test screens 4 common chromosomal issues like Down syndrome, Edwards syndrome, and Potthouse syndrome. It can also tell you the baby's sex. Because it only involves a blood sample, there's no risk of miscarriage or harm. The test is very accurate, with detection rates for Down syndrome above 97%. However, it is a screening test, meaning it estimates the chance of a condition but doesn't confirm it. If the screening shows a higher risk, a doctor might recommend an invasive test for a definitive answer. Invasive tests, like amniocentesis and chorionic villus sampling, involve taking a small sample of fetal cells directly from the amniotic fluid or placenta. Amniocentesis is usually done after 15 weeks, while chorionic villus sampling can be performed between 10 and 13 weeks. These procedures carry a tiny risk of miscarriage, infection, or injury to the fetus, but they provide a clear diagnosis. They analyze the fetal DNA in detail, allowing doctors to detect a wide range of genetic conditions beyond just chromosomal abnormalities. Because they give a definitive answer, invasive tests are often used when screening results suggest a higher risk or if there's a family history of genetic issues. When comparing the two, non-invasive testing is safer and can be done earlier in pregnancy. It's a great first step to assess risk without any harm to the baby. If the results indicate a potential problem, invasive testing can then be used to confirm the diagnosis with certainty. The cost of non-invasive tests is often similar to invasive procedures, but insurance coverage varies. Both types of testing should be accompanied by genetic counseling to help understand what the results mean and what options are available. Most healthcare providers recommend starting with non-invasive screening because it's safe, accurate, and gives you valuable information early on. If necessary, invasive testing can follow to provide a definitive diagnosis. The choice depends on your personal health history, family background, and comfort level with the risks involved. Remember, talking with your healthcare provider about your specific situation is the best way to decide which test is right for you.